Here are high-yield questions and answers on the anatomy of the mammary gland for medical and nursing students, relevant for school. Basic anatomy and function. 1. What type of gland is the mammary gland? It is a modified apocrine sweat gland that produces milk. 2. What is the primary function of the mammary gland? It provides nutrition to the newborn through lactation. 3. What is the anatomical location of the mammary gland? It extends from the 2nd to 6th ribs, overlying the pectoralis major, serratus anterior, and external oblique muscles. Structural components. 4. What are the main parts of the mammary gland? Lobes and lobules. 15 to 20 lobes containing alveoli. Lactiferous ducts drain milk from lobules. Lactiferous sinuses store milk before nipple release. Nipple and areola, pigmented area containing Montgomery glands. 5. What is the significance of the Cooper's ligaments? Cooper's ligaments provide structural support to the breast and can cause skin dimpling in breast cancer. Blood supply and lymphatic drainage. 6. What are the major arteries supplying the breast? Internal thoracic artery, lateral thoracic artery, thoracoacromial artery, posterior intercostal arteries. 7. What is the lymphatic drainage of the breast? Axillary lymph nodes, important for breast cancer metastasis. Levels. Level 1, Level 2, Level 3. Internal mammary nodes. Supraclavicular nodes. 8. What is the clinical significance of lymphatic drainage in breast cancer? Breast cancer first spreads to the axillary lymph nodes, which are examined for metastasis. Innervation. 9. What is the nerve supply of the breast? Anterior and lateral cutaneous branches of intercostal nerves. Supraclavicular nerves innervate the superior portion. Fourth intercostal nerve supplies the nipple. Clinical correlations. 10. What is the anatomical basis of peau d'orange in breast cancer? Lymphatic obstruction by cancer cells causes edema, leading to a dimpled skin appearance. 11. How do tumors affect Cooper's ligaments? Tumors can cause fibrosis and shortening, leading to skin retraction or dimpling. 12. Why is the upper outer quadrant the most common site for breast cancer? It contains the most glandular tissue and has rich lymphatic drainage to the axillary nodes. 13. What anatomical structure is at risk during a mastectomy? The long thoracic nerve, which is C5-C7, which supplies the serratus anterior muscle. Injury leads to winged scapula. 14. What are Montgomery glands? Sebaceous glands in the areola that lubricate and protect the nipple. 15. What is the anatomical basis of nipple inversion? It is caused by tumor invasion of the lactiferous ducts or fibrosis pulling the nipple inward. Development and hormonal control. 16. What hormones regulate mammary gland development? Estrogen right-pointing arrow ductal growth. Progesterone right-pointing arrow lobular and alveolar development. Prolactin right-pointing arrow milk production. Oxytocin right-pointing arrow milk ejection via myoepithelial contraction. 17. What embryological structure gives rise to the mammary gland? Mammary ridge from ectoderm. 18. What is polymastia and polythalia? Polymastia, extra breast tissue along the milk line. Polythalia, extra nipples along the milk line. Imaging and examination. 19. What are the standard imaging techniques for the breast? Mammography help in screening for breast cancer. Ultrasound to differentiate cystic versus solid masses. MRI for high-risk patients. Stay ahead in your medical journey. The mammary gland is a crucial topic in anatomy, physiology, and pathology, especially for understanding breast development, lactation, and breast diseases like mastitis, fibroadenoma, and breast cancer. Mastering this topic is essential for both medical and nursing students, as it plays a vital role in obstetrics, gynecology, surgery, and endocrinology. Subscribe now to dive deeper into the structure, function, and clinical relevance of the mammary gland with high-yield explanations, mnemonics, and case-based learning. Let's make complex concepts simple and memorable. Stay curious, stay ahead.